What if everything we've been told about autoimmunity is wrong? I'm Elizabeth Yarnell. After awakening partially blind one morning in 1999, a doctor told me my multiple sclerosis would put me in a wheelchair within 10 years. I refused to accept that as the end of the story, so I started investigating. Welcome to the Inflammation Investigator, the podcast that uncovers the inflammation lurking underneath your ailments. Because autoimmune and chronic conditions should not be viewed as death knells when they are actually alarm bells. I'm a traditional naturopath and founder of the Inflammation Academy. And in 2 episodes every week, we dig into what conventional medicine might be missing. If you're living with chronic or unexplained symptoms, this investigation is for you. Your body has been trying to tell you something. Let's start listening.
In the last episode, we talked a little bit about how MRIs and spinal taps are used to diagnose MS. But in this episode today, let's talk about the myelin sheaths and what they do and what happens when chronic inflammation damages them. Don't forget, I will be reading, but I will still try to look up at you because I know you're out there listening. In multiple sclerosis, inflammation causes damage to the myelin sheaths surrounding the nerves, disrupting the transmission of information in the form of electrical signals called synapses from the brain to the body. It may be helpful to picture the nervous system as similar to a crowded network of electrical cables, each delivering information to a specific destination via a line of wire. We can recognize a common electrical cord, such as the cord emerging from a lamp and terminating in a plug, and understand it is encased in a plastic sleeve in order to safely contain and focus the energy conducted across the wires from the wall to the lamp when plugged into an outlet and switched on. In the event the protective sheath becomes punctured, frayed, or torn, the delivery of energy to the lamp might cease, or worse, electrical sparks could escape and potentially ignite a fire elsewhere in the room. Sometimes a simple bandage of electrical or duct tape can be wrapped to repair the sleeve and restore the ability to safely and effectively conduct energy from a power outlet in the wall to the lamp via the cord. Similar to lamps, humans are electric beings dependent upon energy moving through our bodies. Unlike lamps, our brains send electric signals along our nerves to inform and initiate all body functions. Similar to the plastic sleeves that cover electrical cords, myelin sheaths are insulating layers of fatty tissue wrapped around each nerve to contain the delivery of electric information from the brain. Such messaging energy leaps from the end of one nerve fiber to the end of the next in what is called a synapse. But when there is damage to the myelin sheath around the nerve, our bodies may apply a bandage, not unlike the electrical tape around a cord, to stop the leak of energy. These bandages on the myelin sheaths may work seamlessly to restore the flow of messages along the nerve, or they may harden into scars in the form of calcified plaques that block the data flow, resulting in the muscular or sensory pain, discomfort, or dysfunction seen in diseases like MS. There may be some correlation between the location of the plaque and the manifestation of dysfunction. people with weakness and/or disability in their lower extremities may have more scars along their spine, while people experiencing more sensory issues may have more scars in the brain itself. Based on annual MRIs, some plaques may not be visible in subsequent years, strongly suggesting that the brain has the ability to heal. And if the plaques are not always permanent, then MS may not be the life sentence we have presumed it to be. In the next episode, we'll talk more about those plaques and how that happens and what scars can do. Tune in then.
And that's another case filed on the Inflammation Investigator. Remember, every symptom is your body's way of communicating. We just need to learn the language. If today's episode sparked something for you, I want to hear about it. Share your own investigation discoveries with me on social media at Elizabeth Yarnell, or find me at elizabethyarnell.com. Your experience could be exactly what another listener needs to hear. And make sure you're subscribed so you never miss an episode. And here's the thing about investigations. They work best when you're not going it alone. If this podcast is helping you uncover the answers you've been searching for, please like, rate, subscribe, and review, and share it with someone who needs to hear this message. As a new podcast, these actions mean more than you know. Want to dive deeper into your own inflammation investigation? Head over to inflammationinvestigator.com, where you can take my free inflammation quiz to uncover which hidden triggers might be affecting your health. Until next time, this is Elizabeth Yarnell, your inflammation investigator, reminding you that the solutions to your health issues are out there. Let's find them together.